Dr. Pekosz, I looked at the statistics today, and particularly the log slope, where slope matters. And California is actually pretty good on a relative basis versus the disaster that is Florida and Texas. Is it fair to combine Florida and Texas together to aggregate their data into what's to come on cases becoming deaths?
Yeah, this disease has shown us that it's really about local spread and local transmission and local cases. So I try not to encourage people to collapse across too broadly across the country or in other states, because it really does matter what's going on in certain localities. I think you're absolutely correct in terms of there are some more worrisome numbers coming out of Texas and Florida and some other states, actually. But again,
right.
Even worse than that, though, is the large number of states that are showing beginnings of increases in cases. And that's telling us that there's a systemic issue going on across the country in terms of how we're intervening to keep the virus levels down.
Yeah, I totally see that. I mean, Alabama and Mississippi having a tough week of it as well. If that's the case, what is the experience we've learned from New York to help Florida?
Well, massive testing, very solid lockdown capabilities in terms of being able to limit the spread of the virus, and waiting until those virus cases get down to manageable levels. And there's a number of guidelines out there. One of the ones that the CDC likes to put forward is this 5% positivity testing. When you get down to those levels, then other interventions like contact tracing can be put in place effectively, and that will then be the tool that will keep infection levels down. But contact tracing won't work when you're having 60,000 cases across the country come through, because that's just too much of a strain on that infrastructure, and they can't be done effectively.
Andy, we spoke to the chief executive of Roche yesterday, and he was saying that he's worried we're testing too much and there are just not enough kits. So he suggested, and he's one of the manufacturers of the kits, that we only, test people with symptoms. Would that be enough to get a handle of it?
So it's an important question. If you're getting tested and you don't get your results for 4, 5, or 6 days, then the testing is almost irrelevant, because you're going to have to be in quarantine for that period of time. And the current CDC guidelines say that you should be quarantined for 10 days after experiencing symptoms. So we have to find a way. If testing is going to be limiting, we have to find a way to use it more effectively. And it may be that we need to scale back who we're testing to speed up the time in which those results are coming through. One would have liked to have seen by this point in time that the manufacturing capabilities and the distribution capabilities for all these tests would have been scaled up so that we can handle a larger amount of testing. But it certainly seems like we're back to the beginning of this pandemic in the U.S., where we're also having a supply chain issue when it comes to the testing.
Do we, I know there are new guidelines about reducing the time that someone needs to stay in quarantine. Is 10 days enough?
It certainly seems like the data that's coming out now is suggesting that 10 days is a very reasonable time for quarantine. The tests that we're using to tell if people are infected are so sensitive that they detect even small amounts of the viral genes, the viral RNA. And it's clear that when we detect those small amounts of RNA, that's not enough virus for that person to spread it to someone else. So the new CDC guidelines reflect the fact that what we're really interested in when we're quarantining someone is the period of time that they can transmit the virus. And going from 14 to 10 days still maintains a high probability that we're keeping people away from other people during their transmission times, but then it allows them to get back into their normal activities a little bit faster when they pose very little risk of spreading the virus.